everyone, I am Dr. Loveleena Nadir, a senior consultant at Rosewalk Hospital. January is a cervical cancer awareness month. So let's talk about cervical cancer. Cervical cancer is the second most common gynecological malignancy seen in Indian women, second only to breast cancer. The incidence is 1,32,000. And the sad part is that we lose 74,000 women every year. And it is a major public health and women health issue. It starts in the cervical cells. That means cells of the cervix, which is the lower part of the uterus. And it is due to the persistent infection with a high risk human papilloma virus known as HPV, which is generally sexually transmitted. But the good news is that although this is one of the deadliest cancers, but it is the most preventable cancers of all female cancers. And it can be prevented by regular screening and by getting vaccinated against human papilloma virus. Now, how is screening done? In the screening, the cells are taken from the cervix by a brush, and we look for any abnormal cells and human papilloma virus. The screening generally starts at 25 years of age. So all women between 25 and 65 years of age should get primary HPV testing done. But if there is no history of previous screening, then it can be combined with a Pap test every 5 years. And only Pap test can be done every 3 years. The symptoms generally are postcoital bleeding, intermenstrual spotting, there can be foul-smelling discharge, there can be a blood-stained discharge, fatigue, nausea, weight loss, lower pelvic pain, back pain. So if you have any of this, you must consult your doctor. Now, at what age do we stop the screening? We stop the screening generally at 65 years of age. Or if there is no history of previous screening, then we can do one Pap test, and if it is negative, then it can be stopped. Otherwise, in patients who have had their removal of uterus, that is hysterectomy, for benign lesions like fibroid or other things in which there is no cancer, then there is no need for screening. But in case the indication for hysterectomy, that means why the uterus was removed, is not clear, then of course it is the discretion of the doctor, and they can do one Pap test, and if negative, then they can stop the screening. So it can be really prevented by doing regular Pap tests, by getting the vaccination done, by practicing safe sex, and by leading an active healthy lifestyle. That means by taking a well-balanced diet, cutting back on smoking or quitting smoking, regular exercise. So these are the things which can, help us in preventing cervical cancer. And of course, WHO is running a drive in which we want to eliminate cervical cancer. So, it is known as 90-70-90. So 90% of girls should get vaccinated by the age of 15. 70% of women should get screened by the age of 35. And 90% women should be offered treatment if they have any cervical disease. So this is the way we can remain healthy and eliminate cervical cancer. Thank you.